Hi, I'm Ken Cutbush. I'd like to talk to you about the risks related to having an anatomic total shoulder replacement. By that, I mean a shoulder replacement that looks like this. I say that because in Australia these days, 80% of all shoulder replacements are actually a reverse shoulder replacement, and that's a topic for another discussion. An anatomic total shoulder replacement looks like this, has a ball, a stemmed, which is what we're talking about here, has a stem down the humerus, and on the other side is a socket. On this one, you can see it's an all-polyethylene socket, and you can see a little X-ray marker just there so that we know where it is. So that's what we're talking about. In Australia last year, 495 operations were performed like this, and they all go into the Australian Joint Registry. If you'd like to look at the results of the Australian Joint Registry, so the Australian Orthopaedic Association National Joint Replacement Registry, just scan that QR code, it will take you to the data, and you can look at the same data that I see. In Australia, there are 16,519 anatomic total shoulder replacements registered into the Joint Registry since its inception. Of that, overall revision rate of 17.5% at 14 years. We have 14-year data. The complication breakdown for that revision rate, so for the reasons for why they were revised, 36.9%, almost 37% were due to rotator cuff failure. And that's the problem with the anatomic total shoulder replacement as to the reverse. With an anatomic, you need to have a rotator cuff. Instability and dislocation occurred in 27% of those patients needing a revision. So a third of them were revised because of instability or dislocation. And 14.4% of the ones that were revised because the prosthesis became loose. Beyond that, I think it's important to give you a rundown of what I explain to patients when I see them. The big thing for me is to let them know that patients have, for me, a less than 1% chance of infection. That can be pretty serious. It might mean removing the prosthesis and putting it back in again. DVTs, hematomas, things like that can happen for sure. When we do an anatomic total shoulder replacement, we take the subscapularis off at the front of the shoulder. That's the rotator cuff tendon at the front of the shoulder. That comes off and is put back on at the end of the operation once the operation is completed. That tendon is very important to the long-term function and outcome of the shoulder replacement. It needs to be protected for the first 6 weeks and is normally protected in a sling for the first 6 weeks after the operation. If it re-tears, which it can, it generally means a suboptimal result for the patient and usually eventually means a revision to a reverse total shoulder replacement. Nerve injury can happen with any shoulder replacement and you do need to be aware of that. It's rare for a serious nerve injury to occur, but it can occur. It's not uncommon for the nerves to be a little bit unhappy. They do not like being pushed out of the way when we put a big piece of metal into your shoulder. And of course, there is the anesthetic. You do need to be aware that there is a general anesthetic and there are risks from the anesthetic. I guess the other thing to mention is the risk of instability in the short term. That can happen with a shoulder replacement. And of course, any of these shoulder replacements will eventually wear out because they're a mechanical thing, just like a car, and will eventually wear out. You should be expecting to get 14, 15 years out of your shoulder replacement. That's what we're seeing. So 17.5% revised at 14 years. It means about 80% of them are lasting, 15 years. And you should expect for most people to get to 20 years after a shoulder replacement. So that's a rundown of the risks related to an anatomic total shoulder replacement. I hope that helps you get some concept around it. Thank you for listening.